Gateway Sports Medicine has grown leaps and bounds to provide quality health care for everyone in Laredo and the surrounding areas, providing multiple sports medicine services for adults and children. Now we welcome Dr. Eduardo Garza, our new sports medicine physician, to our team, helping the athletes of Laredo be at the peak of their performance. Dr. Eduardo Garza brings his knowledge and experience to Gateway Community Health Center. With school around the corner, get your star athlete checked out today and welcome Dr. Eduardo Garza to Gateway Sports Medicine.
Gateway Pediatrics invites you to make an appointment for your child's next pediatric visit for your wellness checks, pediatric vaccines, physicals, and for any other healthcare needs. With 6 clinics to serve you. Call Gateway Pediatrics at 956-795-8100.
Gateway Sports Medicine brinda atención de calidad en Laredo y las áreas cercanas, ofreciendo servicios de medicina deportiva para todas las edades. Le damos la bienvenida al Dr. Eduardo Garza, médico de medicina deportiva. El Dr. Garza brinda su experiencia a Gateway Community Health Center, lo cual ayudará a sus pacientes a que continúen siendo atletas de alto rendimiento. Con el regreso a clases, evalúe a su atleta estrella hoy y dele la bienvenida al Dr. Eduardo Garza a Gateway Sports Medicine.
Welcome to Gateway Today, the show that talks all things Gateway Community Health Center and how you can benefit from becoming a patient. I'm your host, David Cash Vasquez, and I'm excited to bring you some great segments today. You're probably still thinking about your New Year's resolutions for 2023. Well, our family medicine resident, Dr. Courtney Campbell, is here to help you kick off the new year in a healthy way. She'll discuss preventative care, taking ownership of your health, and getting comfortable going to see your doctor regularly. You don't want to miss this important segment on how to start the new year off right. Plus, the new year can be a stressful time, but our licensed professional counselor associate, Bernice Toruco, is here to help. She'll discuss ways to handle stress and anxiety in the new year and explain why mental health is a huge topic of discussion. Plus, she'll also talk about our behavioral health department and how you can set up an appointment or simply just walk into our clinic. In this segment, dental hygienist and 30-year dental veteran Dayvne Borchers Aguerro will talk about how the mouth is the window to the entire body and share 3 tips for managing your oral health in 2023. And finally, Dr. Cesar Banuelos. He's working hard to ensure that Gateway stays on the cutting edge of medicine in our pharmacy. In this segment, he'll talk about the advantages of becoming a Gateway patient and how our Gateway patients benefit from our pharmacy's affordable drug prices. It's easy to see he loves medicine, and he'll share his passion with us in this upcoming segment. We've got a lot of great show coming up for you. You don't want to miss it, so stay where you're at. Gateway Today, the gateway to better healthcare, starts now. It's a new year, and many of us want to make a healthy start to 2023. Our family medicine resident, Dr. Courtney Campbell, has some great tips for preventative care, taking ownership of your health, and getting comfortable going to the doctor regularly.
My name is Dr. Courtney Campbell. I'm a 3rd-year family medicine resident here at Gateway Clinic. I see patients all the way from birth to pregnancy to end-of-life care. Preventative and curative treatments. What brought me to Gateway? I think, in a sense, I've always wanted to work for underserved populations. There's an obvious need for those who don't have insurance or who are underinsured. They receive lesser quality care. They come to the doctor later as diseases have further progressed. And so specifically Gateway, when I have a world of medicine, as much as I love to treat disease, I want to prevent disease, and this is kind of the population that needs it the most. How do we get the patient to participate in their healthcare? How do we get them from being scared of going to the doctor to not only comfortable going to the doctor, but also comfortable asking questions and taking an active participation in their health? And I think a lot of it, we have to empathize with the patients. They don't have the same background that we do. They may not know that something is worth mentioning or whether it's not. They may not know that they should ask this question. And so being more investigative And when patients don't volunteer too much, sometimes you have to do a little digging and they are like, oh, I didn't realize that was abnormal, and so we always have to review all of the systems to make sure. But in terms of getting them to be more active and engaging in their health, I think explanation is really important. I think sometimes doctors, they feel frustrated that it's difficult to explain health. But I think if you can break it down to its rudimentary elements and you can get anyone to understand the consequences of X, Y, and Z, the importance of getting something checked, and just giving them that education, I think that's the first step in giving them the confidence to ask questions. Because if we're just telling them that you have diabetes, you need to take these medications, but we're not opening the floor for questions and kind of instilling the curiosity into their own lifestyle. Like, I like to ask, what do you think it is that you're doing that may be contributing to this issue? And asking open-ended questions and trying to engage them in their healthcare is also really important. A lot of people go towards diet and exercise, and I think, of course, like diet and exercise, everyone should. But more importantly, I think it's good to know a baseline of what your risk is in the first place. I think it's important to know what your cholesterol is, your A1C. People think that just because they're in their 30s that they're not going to be affected by these diseases, but that's just simply not true. And so if you're going to take your health seriously, you're going to start dieting and exercising, you want to lose weight, I think one of the big important steps is to make that connection with your health, what we see on paper, and what you want to do in your lifestyle. And I think having that baseline, starting at the doctor, getting your blood drawn so that you can know exactly how your bill of health is. And then moving from there, you have the ability to be referred to a nutritionist from here. You have the ability to see weight loss specialists here in Gateway. And so I think the first step for anyone who is trying to improve their health in the new year is to come and make a visit, a wellness visit specifically, to see your doctor. Don't wait until you break your leg. Don't wait until you have a headache that won't go away. Come and see us while you're well. Let us draw your blood and let us encourage you to take your health into control moving into the new year. It's a tough job. I won't pretend that it's easy to come and see sick people every day and take people's complaints and try to work with what you have. But one of the things that I've loved about what I do is the progress that I've made with my patients. I love seeing someone come to me on no medications. They may be 80 years old, no illnesses because they've never seen a doctor because they're too scared, and working with that patient to optimizing their health, getting it to the point where they're checking their own blood sugars, they're invested in what their health is and checking their blood pressures. Seeing that change, I think, has been the most rewarding thing. The programs that we have at Gateway to help uninsured and underinsured patients has made my life so much easier and my patients' life so much easier. There's some things that we probably never would have been able to do had we not had things like indigent care and lado a lado. And the drug assistance program has been a miracle worker for us. And so I think being able to finally reach these populations with resources to meet their needs has been one of the more rewarding parts of this job.
Remove the fear when talking to your doctor. I love it. Well, the new year can be a stressful one, and our licensed professional counselor associate, Bernice Toruco, has some great advice on how to handle stress and anxiety. Plus, she'll explain why mental health is such an important topic of discussion and how our behavioral health department can help in this segment called Managing Stress and Anxiety. Check it out.
My name is Berenice Toruco. I'm an OPCA, that's a licensed professional counselor associate, and I am a mental health counselor at Gateway. So definitely, I think you need to take the time for yourself to recognize those feelings. And once you recognize your feelings, just identify why are they making me feel like this, or what is it that makes me feel like this, and then follow up with what am I going to do about it. So breathing would be one strategy. There's many others depending on individuals and personalities that can be recommended, but something that I like to pair with the breathing, my personal recommendation is physical activity. And that doesn't have to be as far as go to a gym and exercise. It can be something where spend some time outdoors, go for a walk, breathe in some fresh air, and be mindful about the experience around you. Pay attention to your surroundings and create that awareness. nature exercises can also be very beneficial, such as grounding, like just take some time to walk outside barefoot and feel how the earth feels under your feet. Things like that. They can be very simple, but at the same time, they can also be very powerful and really help you to ground and de-stress. So I would say I definitely feel a combination of all of those, either at multiple times or, sometimes at the same time. But how do I deal with this? Like I said, I do practice reflection a lot. I try to identify when I'm feeling anxious or stressed, and then from there I try to figure out what is it that's causing me, so that I can approach it from a sense, what can I do different now? What can I do now to make me feel less stressed? But I think one of the biggest ones is being able to identify what you're feeling, so that then you can have a plan of action as to how you're going to improve it. I have not had the chance to sit down and reflect, but I think that something that I always make the time to incorporate is some self-care. For me, self-care is exercise. At least 30 to 45 minutes. Exercising, whether if it's walking, mostly I enjoy weight training, so lifting weights. That's my biggest one. But anything involving me being active for 30 to 45 minutes or being outside is my to-go-to self-care. In Laredo, there aren't many places where you can go receive counseling services or treatment. There's very few. And the very few that do offer these services have a wait list of 2 to 3 months. And so one thing that we have here at Gateway is that patients are able to come in much sooner than 2 to 3 months. So I would recommend, I think one of the biggest things that you need to do, not only at the beginning of the year, but throughout the whole year, would be reflection. Take that time, and it can be take that time, 5 minutes a day or once a week, or the more often you do it, it's preferable. But take that time to reflect on your life, what's going on, what's happening around you, how you feel, and how's that impacting you. So definitely reflect on what happened within the past year that maybe you want to change, or maybe there was something that you didn't get to do. But also take that time to reflect and be grateful for the good and the bad experiences. The breathing can be done in different ways. There's different formats, if you want to say, or different strategies that you can use to breathe. It's all a matter of trying to figure out which one suits best, which one feels better for you. But why is breathing so important? I think that breathing is very important because a lot of times our mind is at a high level of stress. And so our mind is telling our body like, hey, we feel very elevated, we feel really stressed, and it needs something to calm down. So in the moment when you start breathing, taking that time to breathe, relax, and think about your breathing, being in a mindful way, you're telling your body that, hey, it's okay to relax. It's okay to not feel stressed. And so that's when your body starts to realize like I don't need to be alert. I'm safe. I'm in a good place, and mostly, bringing that alertness down, which is what excites us and sometimes makes us feel stressed.
I have a certain urge to take my socks and shoes off and walk around. I will later. But coming up, we've got to head over to Gateway's dental health department to talk oral health, and Dayvne Borchers Aguerro, a 30-year dental veteran, will walk us through it all. Stay tuned. More Gateway Today on the way.
Gateway Sports Medicine has grown leaps and bounds to provide quality health care for everyone in Laredo and the surrounding areas, providing multiple sports medicine services for adults and children. Now we welcome Dr. Eduardo Garza, our new sports medicine physician, to our team, helping the athletes of Laredo be at the peak of their performance. Dr. Eduardo Garza brings his knowledge and experience to Gateway Community Health Center. With school around the corner, get your star athlete checked out today and welcome Dr. Eduardo Garza to Gateway Sports Medicine.
Gateway Pediatrics invites you to make an appointment for your child's next pediatric visit. For your wellness checks, pediatric vaccines, physicals, and for any other healthcare needs. With 6 clinics to serve you. Call Gateway Pediatrics at 956-795-8100.
Gateway Sports Medicine brinda atención de calidad en Laredo y las áreas cercanas, ofreciendo servicios de medicina deportiva para todas las edades. Le damos la bienvenida al Dr. Eduardo Garza, médico de medicina deportiva. El Dr. Garza brinda su experiencia a Gateway Community Health Center, lo cual ayudará a sus pacientes a que continúen siendo atletas de alto rendimiento. Con el regreso a clases, evalúe a su atleta estrella hoy y dele la bienvenida al Dr. Eduardo Garza a Gateway Sports Medicine.
Welcome back to Gateway Today. Gateway Community Health Center has become a primary resource for dental health in the Tri-Counties. Our staff understands the importance of healthy teeth. She says the mouth is the window to the entire body, and our dental hygienist, Dayvne Borchers Aguerro, has 3 tips for keeping your oral health in tip-top shape for 2023. Check it out.
My name is Dayvne Borchers Aguerro. I'm a registered dental hygienist. This coming year, 2023, I will have been a dental hygienist for 30 years. Approximately 25 of those years have been under the Gateway umbrella. I've been associated with Gateway since 1995. My role as a dental hygienist is to, first and foremost, teach people how to care for their teeth, how to keep their teeth clean and healthy when they're not in the dental office. But when they are in the dental office, my job is to remove any heavy deposits, light, medium, heavy deposits, whether it be bacteria or tartar buildup. That is my main role as a dental hygienist. We treat a lot of, in this clinic, we treat a lot of gum disease, whether it be light forms, moderate forms, severe forms. We treat all forms of gum disease every day. There are 3 things that we should do in order to keep our teeth and gums healthy. And actually it should be, or I should say, try to keep our teeth and gums healthy, because even though we practice those 3 things, it's not a guarantee that we're gonna have complete oral health. But those 3 things are, the first and foremost and most basic is brushing. We should brush our teeth 2, preferably 3 times daily. The second thing we should be doing is flossing. We should floss once daily. And lastly, we should be having our teeth cleaned minimum twice a year. When we eat real starchy foods or things that break down into starch, such as breads, crackers, anything sticky like that, it's gonna stick to our teeth more easily, whereas fruits and vegetables won't, because they're not starchy. They're more firm and hard.
Okay.
Yeah, so, and any sodas, anything containing acid or high sugars, they easily break down enamel. And it's not gonna break down to where the enamel meets the underlying tissues or the underlying layers of the tooth. But if it's something consistent and constant, like if you're drinking coffee all day or sodas all day or tea with a lot of sugar all day, all of that adds up, and then yes, eventually it is gonna break down the enamel and it's gonna need to be repaired. I would have to say the people, especially when we have patients that are very grateful, or you know, they say thank you so much. They're grateful and thankful that we're here for them, and I think that is one thing that I really enjoy about my job, is when I hear from those patients how much they appreciate what we do for them. That's one. And secondly, that I've been given the gift to be doing it so long. So I think that since I've been doing it so long, I mean, I don't know everything, you know, obviously, don't get me wrong, but I've been able to learn so many things over the years and correct the things that I was doing wrong, or, you know, change things around. It's the best thing is the patience. That's for sure.
Take control of your teeth, your health with dental hygiene. Well, finally, we have a great segment on the benefits of becoming a Gateway patient with Dr. Cesar Banuelos, who's passionate about medicine and making sure Gateway stays on the cutting edge of medicine. The advantages of being a Gateway patient and how our patients benefit from affordable drug prices.
I'm also the clinical educator for the clinic. I'm in charge of keeping everybody up to date. And I'm also the antimicrobial steward for the clinic, in charge of making sure that our providers use antibiotics judiciously. And I'm also an adjunct faculty member upstairs with the UIW Family Medicine Residency Program. I try to keep myself busy. I enjoy spending time here in the clinic, and I've learned a lot over the years, and I'd like to pass that on to as many people as possible. So our pharmacy is a closed pharmacy. It's specifically for patients of Gateway Community Health Center. We cater to many different types of people. Patients that are unfunded or uninsured, patients that have private insurance, be that commercial insurance like Blue Cross Blue Shield or Aetna. We also cater to our Medicaid and Medicare patients as well. And private as well. So we treat all facets of patients. So you would go see your provider, be it in the pediatric department, adult medical department, or the dental department. They will fax either prescribe a medication to us, or they may give you a paper prescription. We will get it here in our pharmacy. The patient will in turn come and order his or her medication to let us know that they were going to come and fill it with us. We'll have it ready for them depending on if it's a chronic medication or if it's a medication for an acute illness. That will basically garner how fast the patient will get the prescription from us to them. And as you know, we are inside, so we are able to maintain communication with the providers. And I think that's one of the biggest benefits, is that we have access to whatever the provider has ordered for the patient, basically also past medications that the patient has been on. So we are able to, check thoroughly a lot better than I think in other opportunities. Gateway is special in its own way. We have a program called the 340B program. That's something that caters specifically to federally qualified healthcare organizations such as ourselves. Some things that you might be able to get at a higher cost outside of our clinic, we can get at a more fairly reasonable cost, such as insulin, such as your SGLT2s with your metformin combination, something that might typically cost in the range of $400 to $500. You might get at a fairly reasonable price, somewhere in the range of $25 or something to that effect. It depends, obviously every medication has its own price. But there are some medications that I think I applaud the fact that we are able to get that, because I think that's something that's second. There's nobody else in the city that has that capability of doing that. So that's one of the benefits of being a patient of our clinic. Another great thing is, as you know, we have various clinics outside of the county, Jim Hogg, Zapata, we are able to send medications over to Hebbronville and Zapata. Basically we will send them out this evening. So for example, we do have medications that are ready to be sent out for tomorrow. And so the patient will call. They can either go to the clinic, their prospective clinic, or they can call us. We can prepare it for them and send it out, and tomorrow they will have it ready for them. Either clinic, Hebbronville or Zapata, the provider over there at that facility will send over a prescription to us. The patient either will notify us that he would like for us to prepare that medication. They can even pay on the phone while we're actually having that conversation. And then the medication will be prepared, today, and then it will be sent out to them in their prospective clinic, be it Zapata or Hebbronville, and then they will be ready to pick it up, the very next day after they've ordered the medication from us. As a PA and as a pharmacist, I see myself more as a clinician. I like both facets of the field. I think pharmacy is very much important to the practice of medicine. There's so many things that I've learned being a pharmacist that I didn't know as a physician assistant. And it's developed this thirst or hunger to become very well involved with evidence-based practice and researching and truly giving the patient the best of the best, and being dynamic and always trying to be up to date with everything, because as you know, as a matter of fact, we already have the publication of the 2023 guidelines, and it's not even the end of 22 yet. So pharmacy has taught me to scour the literature, to look at it, and to really get in tune with the best that I can possibly give a patient. I'm really proud of the UIW Family Medicine residency program, and you can quote me on that. I'm really excited because it brings an opportunity that we wouldn't have before. You know, when we started to have the residency program, since we've started to have more doctors. You know, most of these residents stay on in Laredo. I know a couple, and we've only had, I believe, 2 years, and so we've already had people sign on to stay in Laredo. You know, and I think that's a beautiful thing. And so my role in the residency department is actually to be a lecturer for them, to teach didactics. So we just recently had a congestive heart failure lecture, and how I harped on them that if you have heart failure, you need to be on these 4 specific drugs, and you do everything you possibly can to get them on those 4 drugs. Because if you do that, the patient will live longer, and there's studies that have shown that. And so if I were to tell you, David, I'm gonna give you these 4 drugs, if I give you these 4 drugs, you could potentially live an extra 2 years, 5 years. What would you say? Give them to me, right? And that's what we harp on. And this is guidance from like the 2022 guidelines. There's no 2023 heart failure guidelines just yet, but for the residency program, you know, it's all about teaching them and giving them as much knowledge as I possibly can, because these are the people that are going to stay here and take care of our parents, our family members. And so for me, it's a beauty to be able to teach them and to be able to learn from them as much as they learn from me. You know, we kind of bounce ideas off of each other, you know. So I'm really excited about the residency program, and I see a lot of beautiful things coming from that place. The fact of the matter is, we're getting people from all over the country coming here to stay in Laredo. And you know, we always had this concern that we weren't getting a lot of people to come to Laredo. You know, we kind of had the same people, you know, and then now we're getting people from all walks of life. And I think that's the beauty of the residency program, is because you get people from everywhere. You know, I know a gentleman here from New York, or, you know, all these different places. And so access and getting, so, and then also getting to pick who you want to see. You know, before we had, you know, these many, you know, physicians, now you're gonna have more and more and more. And I think that's the benefit that Gateway is giving by having the residency program here. More hospitalists, more physicians, you know, and then maybe those physicians later on want to become specialists, and then they come back and become specialists here. You know, as you know, we don't have that many specialists, but maybe in turn in the future we might have more, you know, so.
Our thanks to Dr. Cesar Banuelos and all the staff in pharmacy for that one. That's going to do it for this installment of Gateway Today. Don't forget to visit Gateway Community Health Center for all your medical, dental, pharmacy, and behavioral health needs by visiting gatewaychc.com, and follow us on all social media for updates, upcoming news, and events. Until next time, remember, your health is your wealth, so make sure you take care of it.
Gateway Sports Medicine has grown leaps and bounds to provide quality health care for everyone in Laredo and the surrounding areas, providing multiple sports medicine services for adults and children. Now we welcome Dr. Eduardo Garza, our new sports medicine physician, to our team, helping the athletes of Laredo be at the peak of their performance. Dr. Eduardo Garza brings his knowledge and experience to Gateway Community Health Center. With school around the corner, get your star athlete checked out today and welcome Dr. Eduardo Garza to Gateway Sports Medicine.
Gateway Pediatrics invites you to make an appointment for your child's next pediatric visit for your wellness checks, pediatric vaccines, physicals, and for any other healthcare needs. With 6 clinics to serve you. Call Gateway Pediatrics at 956-795-8100.
Gateway Sports Medicine brinda atención de calidad en Laredo y las áreas cercanas, ofreciendo servicios de medicina deportiva para todas las edades. Le damos la bienvenida al Dr. Eduardo Garza, médico de medicina deportiva. El Dr. Garza brinda su experiencia a Gateway Community Health Center, lo cual ayudará a sus pacientes a que continúen siendo atletas de alto rendimiento. Con el regreso a clases, evalúe a su atleta estrella hoy y dele la bienvenida al Dr. Eduardo Garza a Gateway Sports Medicine.